Most people want to know the best exercises to do for their back, butt, or sciatica pain. But what's actually more important is what not to do. And what's interesting is that it's usually something you just don't know you don't know. And so in this video, I'm going to stress the importance of stopping any form of compression or tension to your sciatic nerve or to your piriformis muscle or to the structures in your back, butt, or leg if you're dealing with some type of back, butt, or leg pain. And the reason this is really important is because tension and compression are essentially the same thing. Oh, and by the way, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my board specialty in orthopedics, and I only work with back, butt, and sciatica pain sufferers all around the world. The goal is to teach people how to use their mind and movement as medicine. If you're curious as to the cause of your pain, go ahead, check out my Better Than an MRI DIY diagnostic guide. You can click the link and download it for free above. And so if this exercise tube or band represents the sciatic nerve, you'll see that tension and compression essentially do the same thing. So if I tension it, it thins out. If I compress it or I squeeze it, it also thins out. And the reason I recommend you avoid any type of positions or at least aim to minimize any positions of tension or compression on a sensitive sciatic nerve is because as little as 8% stretch can start to reduce blood supply. Why does this matter? If you reduce blood supply to the nerve and to the tissues that are irritated around it, you cut off the oxygen and the nutrients to an area that's trying to heal. As little as 16% stretch can completely cut off blood supply to the sciatic nerve. All right, so that being said, let's start by helping you identify, again, what you don't know in a couple different ways. First way, there are probably some things that you're doing because you've been led to believe that they're going to help you out, but they may actually be keeping you from healing because they're tension and compression in disguise. And the second thing is that there's probably things you don't know that you're doing at home, usually habits, routines, just ways of living your life that, again, maybe you're not aware of, but are probably tensioning and compressing the nerve, reducing blood supply, reducing oxygen, as well as nutrients, and ultimately keeping you from getting better. So the first thing, let's talk about different exercises or things you've been told to do, but again, are compression or tension in disguise. So the first one is a back bend. All right, and the back bend has been sort of popularized as an exercise that if you have a herniated disc or if you have sciatica, well, this is something that you should do, right? Because it's going to push the jelly back in the donut. Some research actually suggests the opposite. By bending forward, you actually push the jelly back in the donut. By bending backwards, you actually might cause further compression of some of the tissue, the disc material, that's actually irritating the sciatic nerve. And so we also know that bending backwards actually reduces the holes in the spine, we call them the foramen, where the sciatic nerve exits. So you can imagine if you have a certain area or space in the spine that is already taken up by a disc bulge, now you have less room for the nerves to function, and then you're doing a bunch of this stuff, bending backwards, either in standing or doing cobras or press-ups, because that's the thing to do, right? You could be reducing the space for those nerves to function. You can be closing down on the foramen where the nerves exit and causing further pinching or compression, all right? So just be careful with that. One way you know that it's probably not the right exercise for you is that when you do it, you're feeling symptoms. You're increasing the pain in your back, butt, or leg, and maybe you're noticing some increase in nerve symptoms too, some pain, numbness, tingling going down the legs. And so unless you want to continue doing things which hurt so good, but ultimately are keeping you from healing, like my buddy Zach, who was banging through a bunch of cobras and press-ups, thinking that that was best for him, but in actuality, he found that he needed to do the opposite. He needed to bend his spine forward repeatedly to create a gap to actually reduce the compression in the spine, because we know that if extension reduces the foramen or the spaces where the nerve exits in the spine, flexion or bending forward actually can increase the space. So if the disc herniation is big enough, if that's the cause of sciatica, then flexion can actually be valuable. Bending your spine forward creates more space and less compression, all right? The next thing I would recommend that you avoid, that you may have been led to believe is a good thing, which only tensions or compresses the sciatic nerve, is the figure 4 stretch. Now, there's many different ways to do this, but it's classically done on your back, as you can see here. And either people do it like this with the legs straight, pull up, you pull it across the side, or people do it with the leg bent and then they pull up, or they pull up behind their opposite leg. It's all the same stuff, just called something different. All right, let's be real. And so again, if you have a piriformis or a sciatic nerve, which is going in this direction, right, because that's where it travels, and you're yanking on it, then you're stretching it. You're elongating it, which is reducing blood supply and reducing oxygen to an already sensitive nervous system. So again, be careful. Just because somebody says, hey, this is what we do for this condition, realize that it is a form of compression or tension, maybe in disguise, all right? The next thing, a very popular exercise for people with back butt sciatica problems, nerve glides, right? And again, there's many ways to do those. They're very similar. You can do them seated on the edge of a table or a chair or edge of your bed, or maybe you're just doing them laying on your back like this, right? Where you're straightening your leg, you're feeling some symptoms maybe, or tightness in the back of the leg, and then you're letting it down. And oftentimes this is done repetitiously. But the challenge here is that it's something that can be so easily taken too far that I almost never prescribe it. I almost never recommend it for people with back butt sciatica problems, even though it's like the number one thing you should do is mobilize that nerve. Well, that nerve is ticked off. And so if you're yanking on it constantly, going back and forth, and you're not careful with how you're doing it, how aggressively you're doing it, when you're doing it, the position of your foot or leg when you're doing it. A lot of times people do it and they pull their toes up towards their nose, and it feels really yucky, even without sciatica problems. And so there's just little subtle nuances. You have to be very careful when you're doing sciatic nerve glides, again, if you have some type of back butt or sciatic issue, because the risk is that you tension it too far, and then you reduce blood supply, oxygen, nutrients, and you cause more of an inflammatory chemical reaction or response, okay? The final thing, again, something that you're doing intentionally, probably because, well, it hurts so good, and you've been led to believe it'll be good for you, but is taking a tennis ball, taking a foam roller, and maybe doing something like this, where you're sitting on it. This is a double whammy, by the way. Why is it a double whammy? Because usually people are sitting on it, and what do? Show me a figure 4 stretch as you do it. Can you handle that, or can you not handle that? All right. All right, great. So this is what a lot of people put themselves into, right? Just like self-inflicted wound, basically. So you can stop. Right? So not only are they putting themselves in a pre-tension position in a figure 4 motion, but then they're taking something directly to it. Remember when she pinched this, right? And causing tension and compression at the same time by doing stuff like this, by sitting on foam rollers, all that fun stuff, all right? So again, getting rid of back butt and sciatica pain, piriformis syndrome, is so much more about what not to do versus what to do. And so if any of these things are in your routine, just be careful, because these treatments may be the best of intentions, but could actually be keeping you from healing, all right? So again, those are some things that maybe you just don't know that are showing up in your treatment program. But what about things that are showing up in daily life? And this is what's really fascinating to me, because so many people go places, they get hands-on treatment, they get that deep tissue massage. By the way, that's also a form of compression that you're paying for, all right? And then when they leave, they say, hey, I felt good for a while, but then my problem came back. And it's usually because you're doing one of these things that are contributing to the compression, tension, inflammation type of feedback loop, all right? So the first one would be crossing legs, all right? So if you're doing leg crossing like this, if you're crossing your legs maybe like on the ankle, this is usually a habitual type of thing, so you just kind of maybe get used to this and you don't even think about it. And oftentimes you'll just do it like with the same leg over and over again, and you won't even notice it, all right? So crossing legs, again, not necessarily a bad thing in and of itself, but what is often a yucky motion, meaning a motion that aggravates people with piriformis syndrome, sciatic issues, disc issues, is a figure 4, right? So they're in this position where they say, ouch, Charlie, that really hurts. And then what are they doing when they're crossing their legs? They're putting themselves in a tension position. Tension creates compression, which again reduces that blood supply that we're talking about, all right? So one thing you can do Sometimes it's easier said than done, right? Hey, just don't cross your legs. But that's like a lot of mental effort because it's probably habitual. So you could sit something on your lap when you're working. So maybe you don't take a foam roller, but you could. Maybe you take a ball, maybe you take a folder, right? And what happens then is if you go ahead and you try to cross your legs, the folder, the ball, the cat, whatever, will fall off, and then you'll be like, crossed my legs. Maybe shouldn't have done that, right? So it'll just kind of retrain you and give you a little bit of like an external cue such that you can start to resolve that habit, all right? Now, crossing your legs, or if we define crossing your legs as bringing your knee closer to midline, right, kind of crosses midline or moves that way, doesn't just show up in sitting. It also shows up in the way that people sleep. So for example, if you lay on your side, you will see it. People getting themselves in all sorts of funky positions like this. By the way, what is this? This is stretching or lengthening, compression in disguise, this area of your buttock, right, where your piriformis is and your sciatic nerve is, right? And then the leg falls off, and so now you're moving again closer to figure 4. Some people sleep like that, right? Some people sleep like this. And so you can see the knee is falling closer to the midline. And so something that's often valuable is to take 1 or 2 pillows and put it not only between the knees, so you can not only put it here, but also between the ankles. And you might even get another pillow in there, right, to just keep it like this, more neutral, all right? Knees and ankles is often useful. So that's how crossing your legs shows up in sleep, all right, especially if you do side-lying sleep, and that's just the way you roll, all right? It shows up also in the way that people stand, all right? So if you can stand up. So in the way people stand, right? So oftentimes when we are standing, we keep our feet close together. I don't know too many people who stand like this. I do sometimes. But notice how most of the weight, right? So most of the weight is shifted to the one leg. And what that causes is the hips to kind of drop. So relatively, if the pelvis drops, if I shift all my weight to my left leg, and I'm doing this, and you can see that this pelvis on the right side drops, which relatively creates that knee coming closer to midline. So in order to stop that or become more aware of it, I guess you could put something between your legs, but probably what I would do is I would just say really broaden the sort of footprint or the stance a little bit wider. Perfect. Now, the reason I say that is because now, how likely is it, do you think, that you're going to shift your weight and stand like that comfortably?
No, not so.
That'd be weird, right? So it's easy when your feet are pretty close together to kind of just do this and not really know what's happening. But if you do this, most people aren't going, they're not doing that. And so by kind of locking your hips out or bringing your hips wider and increasing that stance or that footprint, that base, it makes it less likely that you're going to default to just dropping your hip and shifting your weight and just excessively loading one side of the body versus the other, all right? So that's crossing your legs in sitting, in sleeping, and then in standing. Be aware of that. Again, a form of compression tension in disguise. The next thing would be poking the angry bear, all right? This is something that people do all the time. So when they have a pain in their butt, when they have a pain in their back, what do? You take your thumb, you dig it in there, you're constantly checking on it mentally and physically. And so what that does is you are constantly irritating the tissue. It would be likened to you having a cut, right, or a bruise, and you just constantly pushing on it and massaging it. It kind of hurts so good, it creates a little bit of a scramble of the pain signals, but ultimately at the end of the day, all you're doing is reminding your nervous system that something's wrong and you're broken, danger, fight or flight mode psychologically, and then physically you're taking something that's ticked off, that's sensitive, that's potentially inflamed if you're watching this, and you just keep poking it, all right? So I'm not a big fan of like poking things that are painful, so like acupuncture, dry needling, stuff like that. I guess if you want to take something sharp and poke it into something painful, awesome, but realize your thumb can be sharp too. Tennis balls can be sharp. Spiky balls can be sharp. All of this stuff is a way that you are kind of subconsciously, sort of, poking the angry bear and maybe keeping yourself from healing via this tension compression kind of negative stuff, all right? Now, knees above hips. All right, so another motion a lot of people with sciatica and piriformis syndrome find yucky is not only this figure 4 motion, but also this knee to chest or knee above hip position. So like this, for example. Again, what are we doing to the tissue in the buttock if we're doing that? We are lengthening it, all right? And via lengthening or tension, we are also creating a form of compression, all right? Now, the way that this shows up is generally not so obvious, right? So you're like, okay, I don't usually sit like that though. That's not me, right? But it does show up in another way. So exactly this way. She's super sharp. She's been hanging out with me too much. All right. So so sit on back. Sure. If we pull her knees up to her chest, right, can you do both of them? Yeah. All right. Now let's rotate to the side. All right. We've got this angle. Can you see that angle? I call this an acute, less than 90, hip, trunk, angle. All right. And this tells you that your knee is above the level of your hips most likely, but maybe it's not so obvious. Maybe you don't sit like that. Maybe you do sit like that in bed, for example. But now if we don't move her, no, you gotta go back. Okay, if we don't move her, and I freeze her and now I tilt her forward, it's her sitting and leaning on in to work on her computer, to talk to someone, to sit at the coffee table at night and play a game, a board game, or eat a TV dinner or whatever, all right? And so if you think of that hip trunk angle, maybe it's bringing your knees closer to your chest via sitting in a bucket seat of your car. Maybe you're just sitting on the edge of your chair and you're leaning into your work because you just love it so darn much, all right? Or you're getting distracted and you're not aware of it. Again, a habit. In which case, this is an acute hip trunk angle, from above or from below, something to think about. One final way that this hip trunk angle being reduced, causing compression and tension throughout the system, shows up is people forcing themselves to sit up tall. All right, so if you can turn to the side, maybe go down the end there. Perfect. Yep, rotate just a little bit. Perfect. If we slouch, what does it do? It opens up this hip trunk angle. There's less of an angle there, all right? It broadens. Now, if we sit up tall, you can see it creates more kind of pinchiness in the front of the hip, which creates more tension on the backside of the body and makes it more difficult for the nervous system to move. If you don't believe me, try this. So go ahead and slouch. Let your legs uncross. That's another way, by the way, that would be another way that she would move herself closer to crossing her legs and put some more tension through the system. She crossed her legs, her ankle. I don't know if you could see that, but we saw that. All right, so now go ahead and straighten this leg for me. Not too bad?
No.
Cool. Okay, now go ahead and sit up tall. You can try this at home if you don't believe me. Keep that position. Reduced hip trunk angle, but it's good for me, Charlie. But it's also creating more tension back here. How do I know? Go ahead, straighten your leg. Yeah, it's really hard to do. Yeah. Right? And so sitting up tall reduces her ability to straighten her leg because it puts more tension through the hamstring because the butt bone shifts back and also the sciatic nerve. All right? So if you relax, it frees a lot of things up. All right? And so this idea of like, hey, no slouching, sit up tall, maybe, and if it's working for you, great. But if it's not, again, it's probably a form of compression or tension in disguise. And it's not a big deal if you do this for a minute or 2 minutes or 10 minutes or maybe even an hour. But if you're forcing yourself into the box of like, hey, I've got to move like this and I was told I should do these things and you're forcing it, then you could be keeping yourself from getting better. All right. So again, the intent of this video was to kind of help you recognize what you maybe don't know you don't know. All right. A lot of people are looking for the perfect exercise, but in the presence of a yucky healing environment, one where you're constantly tensioning the nervous system or compressing it, the same thing, via foam rolling, back bends, figure 4 stretches, nerve glides, foam rolling, all that stuff probably not going to be that great for you and not conducive to healing. You can do even the right exercises, even if they were things that were going to be valuable for you. Guess what happens? Now if you go into your day-to-day life and you're constantly tensioning, compressing the nerve in ways that you don't know, crossing your legs while you're sitting, while you're sleeping, while you're standing, poking the bear with your thumb, with balls, with the corner of the wall, right? Because it ends up at the right spot and you can just ooch against it and it feels so good. Having your partner massage your butt cheek before you go to bed. All ways of compressing things, all right? If you're sitting with that sort of acute hip trunk angle, either because you're bringing your knees up because of your car or your seat at work or whatever it is, or you're bringing your trunk down, not so sure that's going to result in less compression or tension. And then sitting up tall is another way we also create tension within the nervous system, the butt, as well as the back. Why does this matter? Because blood supply gets cut off as you tension things. The more you tension or compress things, the less blood you have. Well, blood's important because the body's trying to heal, and if it doesn't have the oxygen and nutrients that it needs, guess what? It's probably going to struggle to do so. So hopefully this was helpful. Go ahead, do an audit of your day-to-day life and the things that you're doing, that sheet of exercises that you got. Be careful, right? Let me know your thoughts below. Hopefully this was helpful, and let me know what you find.